I think that's where the P comes in, right? So personalization, right? With this, have to understand Betty and what engages Betty, right? In the whole thing. My mom and dad are using an example all the time. Mom, had three laptops, two, tablets. She was engaged all the time. You sent her a survey, she would fill it out for 2 hours, right, and give you any data you want. But she didn't walk very much. She walked about 300 steps a day. And one of the interesting things when I worked for my last company, was acquired by my last company, they had health and wellness programs. They're like, if your mom starts, taking her medication, we should give her a silver sneakers, reward. And I'm like, absolutely not. They would not incent her. What you should be giving her is a Netflix subscription, right? And they're like, that's counterintuitive. That means she's going to sit in front of the TV instead of getting her weight off and being more compliant. Mom was not going to get the weight off. Mom was not going to walk more, right, from this. This is more palliative care than anything else with it, right? And so win the battle, lose the war, right? From that standpoint, or, lose the battle, win the war. What was my main objective in this whole thing with mom, right? Was to keep her out of the hospital and keep her happy and healthy. Behavioral health goes a long way with this as well, right? And understanding where they're coming from. So mom, you got to understand what motivated her to stay compliant in her care. Dad, and I could reach her through the internet. Dad was completely off the internet, right? Dad had to be engaged other ways, right, from that, and maybe through the persona of of mom, right, to be able to get messages into dad, right, from that. Dad also did a lot of TV watching and stuff, so we built platforms where we can engage on the TV, right, as well. And maybe if he took his medication, maybe we gave him free subscriptions to TV. In the future, AI, and that future is like, it's here now, right? From that, AI will build programs for him that are very targeted toward his interests and needs, also based on his level of compliance. And I also talk about nudge as well. Nudges meaning that little things that I see that he can be nudged into compliance, right? But they're done on his terms, right? Passively, in the background, not in his face. And I think that's one of the biggest things that entrepreneurs and companies miss in all this. They start building gadgets. They start putting sensors in the room, in every corner of the room, and looking at stride and looking at walk and gait and everything else with that as well. And they forget about, how people engage, right, in their own care. I talk about my parents, I'm not meaning to be demeaning, but I can put a really super sexy device that's in the home, and my mom would probably play with the box that came in versus the device itself, right? Like kids do at Christmas time, right? With the play with the wrapping. Really short story, but when I sold the last company to a publicly traded company, Lear, one of the first things I did was I automated the INR system, which was, for Coumadin and blood thinning, right, from that. And my mom was part of the program. There were 75,000 people that were monitoring, and I created a little device that plugged into the back of them and sent the readings in. Prior to that, a nurse had to call the home every single week to get her readings. And my mom would sit on the phone and talk with the person for 15, 20 minutes because she was lonely, right, from that. I quickly learned, or my mom quickly taught me, that when we plugged in the device, the nurse stopped calling. And she got lonely from that as well. She wanted that interaction. She quickly learned how to fake the readings to trigger the alerts so that a nurse would call, right? So just because I build it doesn't mean they'll come, right? And you have to understand human intervention and human need, right, from that. And you need to be able to embrace it, right, from it as well. So it's not just about developing a gadget. It's also understanding the person as well.